The statistics are scary. Experts say 15% of teenagers will self-harm at one point. And in the last year, there were more than 2 million reported cases in this country. In tonight's Health Matters by Holston Medical Group, we sit down with a pediatrician to get some important advice for parents.
Self-harm is a unhealthy coping mechanism that some people have if they're struggling with untreated depression or other mental health issues. It can encompass cutting, burning, other skin injuries, or even taking substances or medications that aren't prescribed to the person.
Dr. Danielle Stevens is a pediatrician at HMG Pediatrics. She says self-harm is more common than we may think. As parents, she says it's important to watch for warning signs, pay attention to behavioral changes, and not just in teenagers, but preteens and even middle school-age children. Self-harm is often used as an unhealthy way to cover up or manage emotional pain.
There's definitely been a lot of improvement in not having such a stigma, but there's still a long ways to go. So we need to kind of normalize this and not make it such an uncomfortable topic to talk about.
Parents should watch for physical signs of self-harm on a child's arms or legs. Also, keep an eye out for excessive use of Band-Aids or long sleeves and pants during warm weather. Remember, if you see these things, Dr. Stevens says don't panic, but calmly express care and concern.
The first thing to do is to approach it with an empathetic or understanding manner, and let your teen or preteen or child know that you want to help them and that you are not judging them, but you want to help them get the help that they need. And then reach out to your pediatrician, schedule an appointment, and we can help you. We can set up the necessary resources, and that really takes a lot of the burden off both the teen and the parent.
Dr. Stevens says they work on healthy alternatives like releasing your anger on a pillow or jumping up and down, encouraging things like a soothing bath, a treatment plan that works, and she says communication is key between parents, children, and your healthcare provider.
Well, certainly a difficult topic tonight, but so important. Dr. Stevens also says those who self-harm usually do not have suicidal intentions, but if left untreated, they can be at a higher risk of attempting suicide. For more information on this topic, please visit the Health Matters blog at holstonmedicalgroup.com.